my life today. So it's your favorite nurse, Zainab, and today I'm actually off work. I am on my resting day, and I decided to come on live today and talk to you guys about malaria. Or I'm trying to debunk the belief that antibiotics can be used to treat malaria. Well, antibiotics do not kill malaria. This is why antibiotics kill bacteria. Malaria is a disease that is caused by parasites from mosquito bites. So, can you see like the relationship? Malaria is caused by a parasite. There are different types of parasites: malaria falciparum, vivax, but antibiotics kill bacteria. Antimalarials kill malaria parasites. So yeah. So when you swallow antibiotics, what it does is that it kills bacteria. And when you swallow it for malaria, it's actually you wasting your money, was wasting resources, causing harm to your body by causing antibiotics resistance. So what you actually need to properly treat malaria are antimalarials such as artemether lumefantrine, coartem, artesunate, chloroquine, and the likes. So next time you're actually feeling sick and symptoms of malaria, it's even important for you to actually do test first because your body is not to be joked with. It's not a field work. It is not it is not for experiments. When you're sick, you go to the hospital, do the right tests, and if you are diagnosed with malaria, then you take antimalarials, not antibiotics. But most of the times, the misconception that people are having here, especially here in Nigeria, because most at times malaria and typhoid fever, or rather enteric fever, they go like hand in hand. A person can have malaria and have typhoid fever at the same time. So most of the times when you go to the hospital, I feel like that's where the misconception comes from, that people think that okay, antibiotics can treat malaria, because when they visit the hospital and go to the doctor, and after the doctor checking them and maybe sending them for investigation, the doctor find out that the person has malaria and enteric fever. So the doctor prescribes anti-malarials like artemether lumefantrine, as well as antibiotics like amoxicillin, amoxiclav, ciprofloxacin, some of that. And so people just assume that those antibiotics are for treating malaria, but they are not. So that's why self-prescription is not even is not advisable, because most of the times, and also I want to talk about like starting your medications and stopping midway. You know, when you go to the hospital and you're diagnosed with malaria, because I do not advocate for self-treatment. I mean, us, you don't treat yourself, you go to the hospital. But when you go to the hospital and you're diagnosed with malaria, then you start taking these anti-malarial drugs and you find out that you're feeling better. So some people tend to leave this, like, you leave the medications before completing the drugs. And that's very dangerous. That's harmful to you because you might be feeling better at the moment, but those malaria parasites, like the strains, they are in your body, and your body can actually get resistant to antimalarials. That's why most of the times now, people People who are down with are down with malaria, when they go to the hospital and they get their drugs and they come and be saying the drugs are not working for them, or the doctor is not good, he prescribed this medication and is not what is wrong. No, it's because you have been abusing these anti-malaria drugs. You start taking them, and when you're feeling better, instead of completing the dose, you stop. Your body becomes resistant to these drugs, and then the next time it hits you harder and you complain that these drugs are not working. So the right thing for you to do is always ensure that you complete your treatment, being it antibiotics or anti-malarials or antifungals, antivirals, any medications that are given to you. Please ensure that you complete it so that your body doesn't develop resistance. And as I said, okay, I think it's even I've already explained it. Hello, if you are joining my live, please let me know where you are watching from and what time it is at your place. And if you have any question for me concerning malaria, the drugs that you're supposed to take, and or the relationship between it and antibiotics. So actually, the other day I was seeing a patient. Or rather, we're having discussion with somebody, and she was like, when she's taking her antibiotics or her anti-malarial drugs, and she actually feels better, she will drop, like she will keep the drugs. And if another person in the family or her friends are actually exhibiting symptoms of malaria, she will give them the rest of the drugs to take, which is like very, very bad. Number one, you didn't complete your course of treatment, and you're putting your body at risk, at developing risks to that anti-malarial drugs. And then you're putting yourself at risk that the next time that malaria is coming back, like it will come back stronger, because like the bacteria and the parasites in our body is like a war between the antibody we ourselves, you get back, and then the antibacteria in our body. Like when you're taking drugs now and you don't complete the dose, they will they will develop like odeshi against those drugs. And the next time you fall sick and you take that drugs, you realize that it doesn't work for you, and you say that that particular drug does not work for you, etc., etc. And then another brand or another type of drugs, anti-malaria of course, would have to be administered for you for it to work. So yeah. Yeah, okay. So I was gisting you about she giving someone else the rest of her drugs if the person has signs and symptoms of malaria per se, or any condition that she was actually taking drugs for and does not complete it. But the truth is that there are some diseases that mimic, like the signs and symptoms are similar. The signs and symptoms are similar. Like malaria, for example, now the signs and symptoms. Do you know that signs and symptoms of malaria are similar to some signs and symptoms of some sort of hepatitis? Now, when somebody is showing the signs and symptoms of malaria, like from your own perspective or what you think, and you decide to just give them those drugs, which are even incomplete in the first place, yeah, you're not helping them. Hello, Jalisa Anik. Hi, welcome to my live. Welcome to my. You are African too. African from where, please? I'm actually streaming this video from Nigeria. Where are you from? So if you're African, I'm sure like malaria is common in your place, because malaria is common in sub-Saharan Africa, tropical regions. So I assume you know what I'm talking about. Please, if you have any question concerning what I'm talking about, concerning taking antibiotics for malaria, please, or if you do that, if you take, if let's reassemble. If you take drugs, self-medications without seeing the doctor, if you do that, stop. If you start taking drugs and stop it when you are feeling better or your symptoms are subsiding, stop. You are doing harm to yourself. You're welcome. You are doing harm to yourself. You are supposed to complete your medications. You are supposed to complete your medications. So yeah, because if you stop your medications, as I said earlier, your body becomes like resistant to that particular drugs, and then the next time you're coming down with that disease, if you use that particular drug, it will not work for you. So yeah, I don't know if you're still watching and you have any question, please go ahead and ask me. Yeah, because I wouldn't like to be mute. Like I wouldn't like to keep on repeating myself, saying the same thing over and over again. But if you're following and you have any questions concerning taking antibiotics for malaria, or you have any questions of the right medications you're actually supposed to take when you have malaria, you can ask me. And also, I do not advise self-medication. If you're having some signs and symptoms, please go to the hospital. Your body is a shepherd, or what did they say? Your body is special. You're not supposed to just take any drugs and consume and take it into your body. You should go to the hospital, be tested, be placed on the right medications, and ensure that you take the medications as directed by the physician. Take it and complete it. Yeah. So hello guys, welcome to my live. Thanks for tuning in. Hmm. So yeah, if you're just joining, oh, I'm stuck. Welcome. Yeah, the food is in the kitchen. Can you give me a few minutes? I'll be done in a few minutes, and then I can attend to you. So yeah, guys, welcome to my live, and I'm talking about or debunking the belief that says antibiotics treat malaria. No, antibiotics do not treat malaria. Antibiotics kill bacteria. Malaria is caused by a parasite from mosquito bites. So it is treated by antimalarials like artemether lumefantrine, Coartem, artesunate, chloroquine, and the likes of antimalarial drugs. So please do not take antibiotics for malaria, because you will be actually wasting your money, stressing your body, harming your body by getting getting antibiotic resistant. And most of the times, that's why you find out that you might be sick, like you might have an infection. But if you are used to abusing antibiotics for the wrong reason, you take these antibiotics and you find out that you're not getting better, because why? Your body is already resistant to that drugs. And that's why I also say go to the hospital and do tests when you're sick, because even in the case of having an infection, there are different types of bacteria. We have Staphylococcus aureus, we have Staphylococcus pneumonias, we have Streptococcus. We have different types of strains. So all strains have like their different like medications, although nowadays we have broad spectrum antibiotics that does like a lot for different range of diseases, you get. But it's very important that you diagnose yourself first. Like you diagnose yourself, and most of the times it's even better when you do MCS, like you understand, microscopic examination and sensitivity, so you know the exact medications that work for you. You get, instead of abusing different drugs, and then at the end of the day you're not getting better. So it's very important that you know that um when you're feeling signs of symptoms of malaria, like you can be having headache, fever, general body pain, malaise, vomiting, stomach ache. These are common symptoms with malaria. When you're experiencing this kind of symptoms, I'll advise you to go to the hospital so that you'll be properly diagnosed with malaria, and antimalarials like artemether lumefantrine will be prescribed to you, and not antibiotics. not antibiotics. Please, antibiotics do not treat malaria. They kill bacteria. So yeah. uh there's something I normally do when I'm on live. Like I come alive and then I notice for like how many minutes it has been before the first person joined me. But I just realized that it's been 15 minutes already, and today I did not take note of how many minutes it took for the first person to join this live. So yeah, I don't have that history today. But then again, people have been coming in and going out. And if you are joining in now, welcome to my live. I'm talking about how antibiotics do not treat malaria. Please, if you are joining in, I'm new on YouTube. So it would be very nice if you can subscribe to my channel, watch my videos, give me a thumbs up. And if you have any question concerning, malaria, since that's what I'm talking about not taking antibiotics for malaria. So if you have any question concerning the disease malaria, any belief, like if you have experienced it now, I don't know, are you someone who has actually taken antibiotics for malaria before, or do you have any story of a friend or family that took antibiotics for malaria? Please let me know in the comment section. Let's discuss about it. Let's laugh together. Let's understand about taking the right drugs for a specific condition. Addison, Roblox, cute Annas. Thanks for joining my live. Hello. So yeah, I was saying, please, if you have done that before, please, and maybe you did not know, I'm telling you now, antibiotics do not treat malaria. What antibiotic does is kill bacteria. Antibiotics are used to treat infection. Now, malaria itself is not caused by a bacteria, it's caused by a parasite from mosquito bites. So anti-malarials are used to treat malaria. My name is Zainab. I'm a nurse by profession. I'm new to YouTube. I'm new to YouTube. I just started putting out content. Mostly what I have on my page actually cooking content, but I'm trying to like deviate to some like more closer to me, like my profession. You get? I feel like I'll be able to more more information, or I have more to give about health. So that's why I'm doing this live and kind of testing the waters, testing the waters. Thank you very much. Yeah, so please don't take antibiotics for malaria. You should take anti-malarials for malaria and ensure that you go to the hospital, do the test to ensure that you have malaria. So because self-medication is not good, you can be doing self medications and you're getting resistance to particular drugs, being it antibiotics or anti-malarials, and then the next time you're sick, you treat yourself with those drugs and you find out that you're not getting better, and you wonder to yourself, why am I not getting better? So please do well. Please like my life. Please do well to like this life. Do well to like this live, support me by subscribing, and also, if you have any idea of any on any other thing you want me to talk about that is health related, I can have another live tomorrow and we talk about it. But today we're talking about malaria and how the right treatments are anti-malaria and not antibiotics. And not antibiotics. And thank you very much actually for sticking with me and watching my live. It means a lot because I'm just starting out on this page, and honestly, oh my god, I really appreciate it, Addison. Thank you very, very much. And since you're just joining my live today and you caught me talking about health related issues, talking about malaria, so I assume that is what you're interested in. And for you to sub to my page, I assume you are encouraging me to give out more contents that are health related. So I would do well to do so. Thank you very much. It just takes one person support to actually show me that okay, I'm on the right path. And thank you. Stop laughing at me. If I don't know if you understand Nigerian slang, but it's actually JJC that is doing me. Journey just come. Even one person, one subscribe, one like, one view it actually means a whole lot to me. So yeah, and if you are just joining my live, please say hi. I'm talking about anti-malarials. Sorry, I'm talking about the fact that antibiotics do not treat malaria, and I do not want to keep on repeating and repeating myself about the same fact, even though people are just joining and might want to know this information. So if you have any question concerning malaria, or you are someone who has taken antibiotics for malaria before, let me know. Or you know someone who has taken antibiotics for malaria, please tell people around you. Let's teach each other. Health education is very important, and it's very important that when you find, I did stop and like Addison, yeah. Thank you very much for doing that. Yeah. If you know anybody who actually abuses drugs without prescription, self medication is not good. So you should advise them that they shouldn't take antibiotics for malaria because they are harming their body, and their body can become resistant to these drugs, and they are actually wasting money is scarce now. Money is a scarce resources. Like you have to budget, plan, and like use your money wisely. So you just going to go to the pharmacy and just prescribing for yourself and taking drugs that will actually harm your body and will not even treat the disease that is disturbing you. You have 1 million, like, oh my god, thank you very much. Thank you very much. I really appreciate it. I hope so too. I hope so too. Do you know that yesterday I actually received a message from YouTube saying that I have hit 100 subscribers, and I was very excited. I was dancing, and I went to YouTube Studio to actually check in real time, and I saw that there were 86 subscribers. So I guess I rejoiced or celebrated early, but nonetheless, I am grateful. I am happy. It means that 86 people are watching my content, or they believe in what I am posting or what I have to offer. That's why they are joining me. So yeah, thank you very much. I would really appreciate it if you are just joining my live. Please support me by subscribing, liking this video, and also note that antibiotics do not treat malaria, and that antibiotics kill bacteria, and malaria is a disease condition that is caused by parasites from mosquito bites. So you use antimalarials to treat it. You use antimalarials to treat it. So yeah, so don't waste money, don't waste resources. Don't be nice to your body. Be nice to your body. Yeah. And remember that health is not for guesswork. Your health is not for guesswork. So yeah, it's very special. So you should really take care of your health. Wow, this is very interesting. It's been 23 minutes of this live, and I think when it's about 30 minutes, I'm going to end this live. So if you are just joining in, please welcome to my live. And if you have seen the topic, I'm talking about the fact that antibiotics do not treat malaria. Malaria are treated using anti-malaria like artemether, lumefantrine, artesunate, chloroquine. So if you have any questions for me, please comment. And your question, if you have taken antibiotics for malaria before, please let me know in the comment section, and please ensure that you don't do that again. And also, if you're having any signs and symptoms of malaria like headache, fever, joint pain, please go to the hospital, be tested, and take the right medication. Ensure that you take the right course of treatment. Do not start taking your drugs and stop midway because your symptoms are subsiding. uh, you have to complete the course so that the sickness will not actually come back worse that you are presently experiencing or you've experienced before. So yeah, please, if you are just joining my life, let me know where you're watching from, what time it is from your place. I'm also very curious, also, those people that are watching my life, like, do you have malaria in your country? Because I know malaria is more an African disease. It's a tropical disease condition, more in the sub-Saharan Africa. So it's not every country that have Yeah, hi Addison. So it's not every country that have mosquito. So I'm sure some people that are joining my life don't even know what malaria is. Malaria is a disease condition in African countries or countries that have mosquito. It is actually caused by malaria parasites. When you've been bit by a mosquito, that's how you get infested by the parasite, and that's how you get infected by the parasite. So the signs and symptoms, the common signs and symptoms of malaria are actually headache, fever, joint pain. Sometimes you can experience stomach pain, lack of appetite. What else? Lack of appetite. Even diseases, sometimes the symptoms are a lot. The symptoms are a lot. So even if you are not actually, even if you are not from an African country, even if you are not from an African country, it's very important you know about this malaria, especially if you traveled, like if you traveled to Africa before, you can be bit by you can be bit by a mosquito and you can come down with malaria, which in Africa now, like in Nigeria per se, malaria is it's very common. Like it's in like every household. It's nothing surprising. People see it as a normal disease like condition, but countries where there are no mosquitoes, they don't really know much about this condition. So if you are traveling to Africa, it's also very important for you like to take vaccination about this malaria. If you have traveled to African countries and you're back to your country and you're experiencing the signs of malaria like headache, fever, joint pain, stomach pain, diarrhea, vomiting, it's very important that you quickly consult the doctor, see the doctor, so that you'll be excuse me, you'll be diagnosed properly and placed on medications. And it's also important that if you're not from these tropical regions that we have malaria, but you have traveled to the place and you go back to your country and you're experiencing these symptoms I just stated recently, it's very important to give your doctor your travel history. That's why in medicine, history taking is very important. When you're going to see doctor, when you're going to see a patient, you have to take the history taking, health history, personal history, travel history. All these informations are very important. So yeah, and this is me going back to the topic of the day, telling you that antibiotics, please, they do not treat malaria. Antibiotics are used to treat infection, bacterial infection. Malaria are treated with anti-malarials as they are. It's almost 30 minutes. When it's 30 minutes, I'm going to end this live. Please, if you're just joining in my live, please say hi. Let me know where you're watching from, what time it is at your place. I would like to know those people that are watching. Are you familiar with the condition we're talking about today? Are you familiar with malaria, or do you know what malaria is? Do you know what the signs and symptoms of malaria is? Do you play Roblox? No, I do not play Roblox. I don't know how to play games. I don't know how to play games. I don't even know what Roblox is. But the fact that you said, do I play? I assume it's a game. No, I do not play Roblox. I do not really play games actually. So yeah. Hmm. So if Addison, where are you watching from? Are you watching, which country are you watching from? What time is it at your place? Let me know. Yeah, please, if you are just joining my live, please do well to support me, subscribe to my channel, like this, like give a thumbs up to my live. If you have any question concerning malaria or the drugs to take when you have malaria, in as much as I'm telling you the drugs you're supposed to take when you're having malaria, you need to go to the hospital and diagnose yourself. You have to be sure that what's wrong with you is actually malaria before start taking these drugs, and make sure that whenever you're given medications to take, you complete the whole course. You don't stop taking medications when the signs and symptoms subsides, because you would not want to gain resistance to that drugs. It's not wise. It's not a good idea. Yeah, so and I think I'm about to come to the end of my life. For those who have joined my life, thank you very much. Thank you very much for sticking with me till this point. Addison, I can see that you have been here with me the longest. I hope that you learned something today from me. Please do well to come back tomorrow. Also, same place, same time, inshallah. I'm going to be talking about a different condition. Mostly, I'm going to be talking about, I'm going to like debunk a rumor, like misconception, just something to the fact that antibiotics do not treat malaria, you know. So, I'm just going to treat something like I'm going to talk about a misconception. So, yeah, please do well to join. Thanks for the thumbs up. Those that have subscribed to my channel, I really appreciate it. Those that have given me like, thank you very much. I really appreciate it. Thank you. See you tomorrow next time. Thank you for joining my live. And by the way, to end this live, Nurse Zainab. Savage.
So, no, Zainab, next time, type here like.